Hello, I'm Dr. John Hancock, Executive Dean of McGovern Medical School. Artificial intelligence and personalized medicine are more than just buzzwords at McGovern Medical School. Faculty in our Department of Diagnostic and Interventional Imaging are employing new technologies to help provide diagnosis and specific treatments tailored to individual patients. Through their creation of 3- and 4-dimensional imaging, they are able to help patients and their surgeons achieve optimal outcomes in a broad range of diseases. Dr. Rory Askos, Professor of Diagnostic and Interventional Imaging and Section Chief of Neuroradiology, explains how this technology of tomorrow is helping patients today.
Healthcare is changing, and one of the ways it is changing is through informatics. And informatics is really targeting the most important parts of all medicine. And in our case, it's imaging. After a lot of developments that have happened over time, now we're able to do 3D models from the images that we obtain from patients. That means CTs, MRIs, ultrasounds, anything we have. And those models can be used to improve surgical outcomes, plan surgeries, to teach patients, but also to be a lot more accurate in our diagnosis. So the difference between 3D and 4D is mostly adding a new variable. If you're measuring, say, an MRI intensities, and you're doing MRIs very fast, you can multiply the times that you acquire the MRI and do an intervention. And then through that intervention, measure how the body reacts to that. And that would be 4D. The images are so high resolution that we can do things like morphometry, which is measuring things much better than we could before. So now we can measure, for example, a tumor and see the function of the tumor and how it behaves. Then after an intervention, which would be treatment over time, we can see how much it has grown or shrunk. And that is the real key for having advanced imaging. Another great thing that we can do is that before they go into surgery, we can tell those surgeons what type of device is going to be specifically needed for that patient. They can measure what they want. They can do a 3D model of it and practice outside of the patient. And they can even train other clinicians that are training in that modality to do the procedures before ahead of time. Advanced imaging helps in a lot of ways. Great examples also is the way that we're working with the cardiologists. When they have patients that need a heart valve, we can help them do exact measurements that they need and identify what is the device they need to be putting on the patient before they do the procedure, which really saves a lot of time. It's much safer for our patients. Or what we do with our fetuses. So when we have a fetus that has a diaphragm with lung problems inside of the womb, or they have a dysraphism, which means that their spine is not formed completely and it's open into the fluid that surrounds the baby, we can do scans and we can do 3D models of them and identify how to treat them so the surgeon can go while they're still in the womb and operate. So these are very interesting things that we can do utilizing these technologies.
These are exciting times for advancing medicine. Through collaboration by our faculty experts, our patients and future physicians are reaping the benefits of innovative technology. Thank you for joining me for this episode of Hancock's Headlines.